Hi guys! Welcome back to my channel. This is Inday Changge, your nursing charge. And yes, for today's vlog, we are going to talk about how are we going to surpass emergency nursing. Specifically, how are we going to fix our trauma patients. Do you still remember the time that you are walking in a busy road, then suddenly there's a road crash and you don't have a choice because you are the only nurse in that area? In my experience, what I remember is that mayroong nag-crash sa harapan ng bahay namin. Tapos, biglang yung mga tao pumunta sa bahay namin at hinanap ako. kasi wala silang ibang mahanap na mag-a-assess sa patient kung buhay pa ba or patay na. And sad to say, yeah, I faced the challenge. And yes, I was a little bit nervous by that time because I forgot those steps in trauma nursing. Nakakahiya, diba? Parang ang alam kasi ng kapitbahay mo, ang galing-galing mo. Pag sinabing nurse ka, lahat na lang itatanong sa'yo. Syempre, feeling mo parang ang galing-galing mo din. Diba? Kasi kahit yung hindi mo alam, aalamin mo na lang para sa kanila. Para saan ba to? Ano ba to? Ano bang gagawin ko dito? Ano bang mga pwedeng gawin para maiwasan ng ganito? Di ba ang daming nagtatanong na ganun? And by the way, going back to the topic in trauma nursing, I am going to give you the tips on how are we going to surpass and be a boss in emergency department. But first, let's have the intro. And yeah, I forgot to tell you, please click like, comment, and subscribe on my channel so that you're going to be updated on whatever update that I'm going to take. I already showed you a simple glimpse of emergency department thingy, and I guess that is all about the ABC or KAW, which is which vlog. We can see it here in this area. So to give you a brief strategy in surpassing trauma nursing, here are also the tips on how are we going to survive in our trauma nursing examinations. First on the list is that always remember when we are dealing with emergency trauma cases, the assessment is vital and every second counts. I'm going to give you a lot of mnemonics. So get ready with your pen and paper and let's discuss. Letter A, airway and alertness. Airway is our priority and let's consider alertness. So here in letter A, we need to assess for alertness and airway. But how are we going to do it? Talk to our patients. So by simply talking to them, you are already assessing their airway patency. If the patient responds to you in a manner that they can easily identify who they are, where they are, and why they are in the hospital, that patient is still okay. But do not forget that your patient is trauma. In trauma cases, every second counts, so they might be deteriorating later. Always assess and always monitor for their alertness. And here in alertness, I'm going to introduce to you to Mr. AVPU, AVPU. So here in AVPU, we are actually measuring the spontaneous alertness of the patient. This is actually the simplification of Glasgow Coma Scale or the GCS. So, what is AVPU? AVPU stands for A for alertness, V for voice, P for pain, U for unresponsiveness. So, how are we going to assess for the patient's alertness using AVPU? Use your voice first. Once you're going to attend to your patient, just ask their name. If they will respond immediately, that means that the patient is alert. Letter A. The next one is V. If the patient did not respond with his eyes and just respond verbally, that means that the patient is responding through verbal. So you can write it in your assessment. Patient's alertness is V. The third is pain. If the patient did not respond to you using his eye contact and verbal response, you can use pain stimuli. Just pinch the sternum of the patient. You're in this area, you can pinch a little and assess for their level of consciousness. So you can do like this. Hey sir, hey, are you okay? Pinching the sternum. The last one is unresponsive. Once the patient is not responding verbally and through the use of pain stimuli, that means that your patient is unresponsive and the patient needs an immediate resuscitation. This means that the patient doesn't respond to any stimuli. So maybe the patient needs intubation. So that is in the AVPU, wherein it's A in the trauma nursing. The next A is the airway. Here in the airway, we will consider the C-spine of the patient. If you go back to the first vlog that I did with the ABC, you are going to see any obstruction around the patient's airway or around the patient's mouth. By how? Check for any edema. Also, check for any missing teeth. Maybe the patient, during the MVA, for example, the patient lost his teeth and it's already an obstruction. And of course, stop, look, and listen to any snoring. Any abnormal breathing needs an immediate care. And also, check for the edema. An edema to face and neck can obstruct patent airway. Always remember to immobilize the cervical. And remember this, C3, 4, and 5 keeps the diaphragm alive. C3, 4, and 5 keeps the diaphragm alive. So meaning to say, if you are going to immobilize the cervical area, that means that you are saving the airway of the patient or preventing the patient to develop any life-threatening complications. The second one is breathing. Here in the breathing, we are going to assess for the respiratory rate of the patient. We are going to see if the patient is hyperventilating, hypoventilating, like that. Always assess for the depth and rate of the patient's breathing, and always check for the lungs symmetry level. The third one is circulation. Here in the circulation, we are going to check for the pulse of the patient. If the patient is unresponsive, where are we going to check for the pulse? It's not here, it's not here, it's here, in the carotid area. Always remember that. The pulse near to the brain. So we need to use the carotid area, especially if your patient is already unresponsive. Remember that checking the pulse is absolutely essential, because if the patient has no pulse and no breathing, of course you are going to initiate high quality cardiopulmonary resuscitation. Here in the circulation, you need to check for any obvious bleeding, because your patient might develop any hypovolemic effect. And in trauma patients, always consider inserting large bore cannula, maybe gauge 18, gauge 16, gauge 14, gauge 10. Those are the cannula that you need to insert to the patient, because the patient might have blood transfusion later on. Next is D, disability. Here in the disability, again, you can check for patient's alertness, patient's GCS, neurovital status, how the patient walks. You need to check all of those. Letter D, disability, and also check for patient's pupils. Any trauma patient can deteriorate, so always remember your primary assessments. Letter E, expose, examine, and check for the environment. Here in letter E, you need to expose for the patient's body. Remove any unnecessary clothing. Remember, wag kang gagamit ng blade sa pagkakat ng damit ng patient mo. Kasi baka masagatan mo siya. You might inflict another pain to the patient. So, mas maganda gumamit ka ng trauma scissors. Never ever use blade. Kahit na minsan hindi na available ang trauma scissors. Pero, in ideal way, wag kang gagamit ng blade sa pagkakat ng damit ng pasyente mo. Here in E, you are going to expose for the patient's body, because you are going to see any abrasions to the patient's body. And I'm going to share you another mnemonics. That is DKAPBTLS. In exposing the patient's body, you are going to check for deformities, contusions, puncture or penetrations, burns, tenderness, lacerations, and swelling. Always remember DKAPBTLS. You are going to see those things or assess those things when you are already exposing the patient's body. Next to exposure is the examination. As I've mentioned earlier, use the mnemonics DKAPBTLS if you are assessing or examining patient's body. Always put that into your mind. Whenever you are already checking or exposing the patient, you are checking for any DKAPBTLS. Another E is the environment. Keep your patient warm or maintain normothermia. Letter F is full set of vitals. Always check for BP, pulse rate, RR, temperature, saturation, hemooxygenation, and pain level of the patient. Always remember your patient's full sets of vital signs. You need to check that every now and then. You need to monitor for the patient's vital signs, because as I've mentioned earlier, your patient is still at risk for deterioration. The other F is family. you need to consider also the family of the patient. Kasi ikaw ba naman te, maa-admit ka sa hospital or itatakbo ka sa emergency room, sino yung unang tatawagin mo? Di ba pamilya mo? Or, of course, if the patient is unresponsive, who are going to sign for consents? The family members. But of course, for emergency cases that the patient already needs an immediate resuscitation, the doctor can give the consent if a family member is not around. The doctors can consent for the patient in emergency situation except if family members are around. Letter G is get for resuscitation adjuncts. What I mean here is that your patient might be overreacting sometimes. So, you need to get a carbon paper bag para mailabas niya yung mga hangin or hindi mag-hyperventilate yung pasyente. Also, get for medications and dextrose. Here in G, you also need to give medications, pain medications, because you cannot assess patient's condition if the patient is in pain. The doctors must order first pain medication in order for them to have a good assessment, especially if the patient is alert. Next is H, the head-to-toe assessment. This is already in the secondary assessment, emergency nursing. So here in head-to-toe assessment, you are already going to check all those things in the patient's body or in the patient's condition. Here in head-to-toe assessment, you can use again that DCAP BTLS that I mentioned earlier. Another H is assess for patient's history. We can use the mnemonics sample here. Sample stands for S for symptoms, A for allergy, M for medications, P for past medical history, L for last oral intake, and E for events or environment. So here in sample, S stands for symptoms. That means that what are the chief complaints? You need to assess for that one. The chief complaints the patient suffered before the accident. A for allergy. Always note for the patient's allergy so that you will be having a good management to the patient. M for medications. Those medications that the patient took before the incident, any prescribed medications that the patients are taking so that there will be no contraindications or any drug-to-drug interactions while you are giving your resuscitations. The next is P, past medical history. You need to note on that one because there might be comorbidities that the patient have, and of course, you need to consider those when you are giving emergency treatment or any emergency resuscitation. L is last oral intake. You need to note that because during emergency, there will be imaging that will be done to the patient like PAN-CT, CT with contrast, MRI, and those needs NPO preparation to the patient. The last one is the event. What are those things that happened before the incident? Remember that knowing the patient's history will throw you to a good treatment. And knowing the history of the patient is using sample. The last one in the list is inspection. In trauma patients, actually, I hate to do this all the time because most of the time my patients are bigger than me, heavier than me, and it's just exhausting doing the log rolling. Yeah, in inspection, you need to check the back of the patient by log rolling. This is a problem in trauma patients because we have understaffing in the hospital. So, most of the time, it's hard to do the log rolling. In log rolling, the one in the head part is the leader. So, he will count 1, 2, 3, then turn. Of course, the one who's assessing it needs to remove the backboard and assess already. DCAP BTLS. Remember that. You need to assess for any deformities, contusions, abrasions, puncture or penetrations, burns, or any bleeding, tenderness, laceration, and swelling. Also, after the log rolling, never ever forget to check for any pelvic tenderness. Because in trauma patients, if their pelvic area is affected, it's already detrimental and it's life-threatening. Needs emergency care. Do not ever forget this A, B, C, D, E, F, G, H, I when you are dealing with trauma patients. After stabilizing the patient, you are already ready for sending the patient to any imaging procedures like PAN-CT, skeletal x-rays, and others. And never ever forget to be ready for any intubation if the patient is unresponsive. So I guess there's nothing more that I can add on this video. Thank you so much for watching. Please check my other videos to help you in your review and to stay motivated in nursing. Also, don't forget to click like, comment, and subscribe to my channel, especially if you are new. If you guys want to have those reviewers that I have or any nursing books that I have, please comment down below so that I can send you those copies that I have. Thank you so much guys for watching. I hope you are inspired again by this video and do not ever give up. Always remember, in nursing, you are not alone and we are here to guide you. That's all for this video. Thank you so much. Bye!